Hi everyone, I'm Khaled. I'm a third year medical student and I'm here to tell you all about what happens if you take way too much Tylenol, Paracetamol, Acetaminophen, whatever you want to call it. Yeah, I know this isn't Tylenol, but we don't have that over here. This is essentially the same thing, so just get over it. As I'm sure you're already aware, Tylenol is a painkiller and a fever reducer, or in fancy medical terms, an analgesic and an antipyretic. Which, by the way, Tylenol in fancy medical terms is referred to as acetaminophen in American, and paracetamol in literally anywhere else in the world. Now, we don't have to worry too much about the details on how this drug exactly works, because it's a little bit complicated and I'm not trying to bore you out here with a lecture. So let's just say it works by turning down the pain sensation and the thermostat inside your brain down. By magic. Now, before we talk too much about taking way too much Tylenol, we need to actually discuss how much is normal amount of Tylenol, or rather how much Tylenol your body can take before it freaking explodes. Let me get you in on a secret. It's actually pretty simple to find that out. If you take a packet of Tylenol or anything that resembles Tylenol, and you go to the back, you can probably find the maximum dose allowed. Now, if you look over here, it says exactly what you're supposed to do and not exceed. That's crazy. But the more scientific answer to this question would be about 3,000 to 4,000 milligrams of acetaminophen, which is about 3 to 4 grams. Now, depending on which brand of acetaminophen you're taking, each pill would have around 325 or 500 milligrams of acetaminophen. And each of those brands usually recommend 2 pills at once for adults. Now, I'm not trying to scare you with the math here, but if each pill has 500 and you're taking 2 pills at once, then you can take 2 pills 4 times a day to reach 4,000 milligrams. So that would be about the safe maximum dose of Tylenol you can take per day. Any more than that and you're entering the spooky territory. So now that we've established the normal amount of Tylenol you can take per day, what happens if you take too much Tylenol by accident? Well, it depends. Now, if someone takes above the normal limit by a little bit, then they'll probably be fine, but they might experience some overdose symptoms like nausea and vomiting, so they should get it checked out and go to the emergency room. Don't ignore it, I warned you. But what happens if you actually go way above the limit? Well, to put it in very simple terms, your liver just freaking explodes and you kind of need a liver to live, so that's not ideal. Okay, let's tackle this a little bit more scientifically. When you take an acetaminophen pill, it is absorbed by your digestive system, it enters your blood, it does its magic inside your body, and then you need to get rid of it. Here's where Big Boss Liver comes in. Think of your liver as a factory. It takes in these acetaminophen molecules and converts them into something else in order to get rid of them. However, as it's dealing with these acetaminophen molecules, it converts them into a very toxic intermediate called NAPK, which stands for N-acetyl P-benzoquinoamine. Who comes up with these names? This very toxic NAPK is usually converted into something safer very quickly by the liver. However, when you take too much acetaminophen, you're kind of taking this extra acetaminophen and shoving it all on the liver. And what that does is overwhelm the liver. And what that does is overwhelm the liver with way too much NAPK that it can't deal with, and it starts building up inside the liver and killing it. Which I think I have the qualifications to point out that it isn't exactly healthy for your liver, I would say. But you know what wouldn't kill your liver, but in fact make it 10 times healthier? Hitting that like and subscribe button to spread the message and save everyone's livers. Thank you. Well, Khaled, you have to be pretty fucking dumb to take more than 15 or 16 pills of Tylenol a day. Well, to that I say, maybe. But you're not off the hook yet. A lot of the time it gets pretty freaking confusing whether or not a product has acetaminophen or not. A person may get a little bit confused and take a regular acetaminophen pill for their pain, and at the same time they may be experiencing a flu or a cold and taking a different medication to treat their cold and flu. And they both have acetaminophen inside of them. And if they're taking the maximum allowed doses for both medications, they've practically doubled the dose of acetaminophen, thinking that they're completely different medications. And now they're speedrunning towards liver failure. Also, think of children. Those little gremlins like to put a lot of things in their mouths, and pills aren't an exception. So they might accidentally overdose. Elderly people might also overdose if they forgot that they've taken a pill already, or if they get confused between the labels. So getting an overdose there is very easy as well. In fact, you know what's crazy? Taking way too much Tylenol or acetaminophen is the leading cause of liver failure. It's even more than alcohol, which is crazy because we all know alcohol does a pretty good job at beating up your liver. So how do you recognize an overdose? First off, if you're suspecting if someone has overdose, please call 911 right away because you don't want to take any risks. Better safe than sorry. For the symptoms of overdose, it's actually pretty vague. There are many non-specific symptoms such as nausea, vomiting, lethargy, which is the awful sensation of feeling very sluggish, abdominal pain, and liver tenderness, which means if you touch the liver, it'll feel painful. In case you're wondering, your liver is located in the top right corner of your abdomen. Right here to be exact. Now don't get me wrong, other signs and symptoms do exist, but if there are missing pills suspiciously and you see someone experiencing these vague symptoms, then you should probably take them to the ER. So how do we deal with an acetaminophen overdose? Usually it's through infusing a medication called N-acetylcysteine. I'm not going to go too much into details, but basically N-acetylcysteine helps the liver cells clear off that very toxic napkin we talked about earlier. So let's blame it on the pharma gods and the work of magic again. Usually this medication is most effective within 8 hours of an overdose and up to 24 hours. Again, if you suspect someone has overdosed, please don't waste time and just take them to the ER. It's better safe than sorry. Even if there is nothing, at least you made sure. But hey, at least the liver didn't explode, so that's a good thing. If you enjoyed this video and you find yourself wondering how seizures exactly work, well, I've got the video for you right here. Thank you very much. Have an amazing day.